We're good? Okay. I have unmuted. Okay, I want to call this meeting to order, and I need to do a little housekeeping first. You notice that I took my mask off, and first I want to state that we are adhering in this meeting to the Healthy at Work guidelines, which were last updated July 10th. And it's basically for businesses and work, which that's what we're doing right now. We don't have students present, where the Healthy at Work guidelines say that you need to wear a face covering except for the following, and that includes any person giving a speech or broadcast to an audience and is able to maintain a safe distance of 6 feet from all individuals. We have set this room up to be 6 feet apart, so if you would like to take your mask off, you are free. We are 6 feet apart with Dr. Chesser's stick, and so I just wanted to clarify that because we will find out a little bit later in this meeting when Dr. Chesser makes her presentation that the Healthy at School guidelines have changed for masking, and we will be adhering to those, and Dr. Chesser will provide more information on that. The other housekeeping item I want to state is we do have a section for public comment tonight. And if you intend to speak, if you're here in the audience and you intend to speak, please sign up outside with Mrs. Flaherty. And we ask that you sign up prior to 6:40. So we're kind of giving you a little 10-minute leeway that if you have decided you want to speak, please feel free to sign up. If you think you want to speak, sign up. And if you choose when it comes your time, you can pass and not have to speak. But we are not asking people to pass and allot their time to somebody else. Comments tonight will be limited to 2 minutes, and Peggy is going to have a timer on these screens for you. When you come to the podium, please make sure that you sanitize the podium after you are done. We ask that you put on your mask when you move, because we still have the when you move, please mask in the Healthy at Work guidelines. The school board members and the superintendent will be taking notes during the public comments section, but we will not be interacting directly with the individual speakers. It's not a forum, it's meant to be public comment, so we won't be interacting at that time, but we will be taking notes, and in our discussion, if there's something that comes up, we hope that we can address it. And the other statement that I want to make is that we have, as the school board and the school district and the superintendent, received many emails from concerned parents. And I want to assure the members of this community, of this room here, of the people watching on YouTube, that the board and the superintendent are very familiar with all of these emails. We get them, we read them, but many of these emails mention specific students, and they mention their specific situations, and consequently, those emails cannot be read or shared in our public setting. So I just wanted you to know we have received those emails, we have taken them into account if you submitted those as part of public comment. With that said, I don't believe there are any other housekeeping items, correct? Correct. And so we're going to start, there's one more. This is a special meeting. So a special meeting means that you can only have the items on the agenda. So our agenda tonight is first in the discussion, a presentation regarding return to in-person instruction with Dr. Chesser. The next section will be when we take public comment. I will call people up based on the cards that I have here. What I will do is I will call the first person, and then I will call person who will come up next so that you're prepared. I don't know if we have anybody upstairs or not. No, we do not. So everybody who's in here, you'll know that you're next after. And then after that is when the board will take action and we will have our discussion. And at that time, public comment is closed. So with that, I'm going to turn it over to Dr. Chesser, who is going to give her presentation on the return to in-person instruction.
Okay, first of all, I just want to thank everyone who is here and also everyone who sent in emails and comments supporting decisions or asking questions or all of those things you did. We take every one of those to heart, and they are very meaningful. We also appreciate all of the signs of support. One of the people who emailed one time said, You have the hardest job in America right now. I'm just going to say everybody in this room has the hardest job in America right now. Our children are our precious resource, and our staff who take care of them, our teachers, it is vitally important that we continue to keep everyone safe. We know physical safety is one aspect of, of our children's well-being, and we'll be talking a little bit about what we're going to be doing to make sure that everyone is safe as we come back to school. So what I wanted to address tonight, first of all, a little bit about the timeline to in-person instruction and why we are where we are and what we anticipate happening in the future, unfortunately, probably throughout this entire year. In addition, we want to talk about data. And in this time of lots of different sources of data, what are the data that we can use to make decisions? What do we compare that with? How do we make sure we are definitely looking at this scientifically? In addition, we want to be able to tell you about our data dashboard. One of the things that we've had to do, because it does not exist, is take all these pieces of data and put them in one place, and so that will be found on our Healthy at School website. We'll talk about that. In addition, what might be the criteria so that we know we're going to be moving to NTI rather than having to do something like this, have a meeting, have to lay it all out. And then, of course, you'll hear about student and staff safety precautions. Some of you, especially if you're teachers, you've heard this over and over, but we thought it was really important for everyone to understand all of the precautions that we are taking. So first of all, why is this important for us to bring our students back? And I've heard this quote before that is, when you know better, you do better. And so what we hope you'll learn tonight is that as we have learned more information, as we know more about what our current situation is, as we know more about decision-making at the state level, we know we have to do something. Probably the easiest thing that we all could do is just have said in May or June, we're just not coming back to school. I can't tell you the number of hours, the 24/7 days, the amount of constant problem solving that many of the people in this room have done. Whether that's our principals, whether that's our district administrators, our board, our teachers, everyone has worked fearlessly and tirelessly to be able to create a situation where our children can come back to school. Again, it would have been really easy just to say, we're just not going to do that. But we knew that these things on this screen were vitally important. So when we know the current data, when we know the information, when we know the harm that can happen to children, then we have to do something about it. So why is it important? First of all, our children's mental health. We have talked to several therapists. Dr. Richardson is here. He talks with us all the time. He's a clinical psychologist, therapist, our local behavioral health facilities, such as Sun, Lindner Center of Hope, North Key, and there is a dramatic increase in suicidal ideation, in suicidal threats, in suicide, withdrawal, anxiety. We are at a precipice. You know, our kids have been in isolation. I'll be honest, I saw the other day the seniors coming to Highlands High School, and, you know, some have a group, right? They've got this 2 or 3 kids, or they've got a small group, but a heck of a lot of kids have been by themselves. And it's extremely sad to continue that. You can tell that our children are suffering from being away from others. So we can go on and on about that, but you all know the mental health damage that's happened. Social emotional development. Unfortunately, we have parents, you know, many of the times when we're getting emails and information from parents and they're advocating for it's really important to get back to school, they tell us stories. And unfortunately, we've got situations where students' executive functioning skills are down, their ability to work with others, their ability to self-regulate. And we maybe don't understand. I think we all know the importance of school, but I think this time of isolation has magnified that, the important work of our teachers, the important work of our staff. And so that's another area that we've got to get kids back. Physical needs. I'm not just talking about exercise, but again, Dr. Richardson was talking at our reopening task group meeting the other day, and he says, these kids, their nutrition is all out of whack. If you're at home and you're just eating snacks all day, or you've got kind of an irregular system where you aren't waking up till late, that's not really good for physical development. And so it's very important, again, for us to bring students back. Student safety. We're in a totally different place now than we were back in March. In March, no one really knew anything about what was going on. We were all scared to death. I mean, you didn't even want to get your mail for like 3 days in case there was a problem. And no one was going to work. We were completely locked down. Now, people are going to work. I can't tell you how much information we have on people saying, you know what, I'm a teacher in Cincinnati. My wife is a nurse. We don't really have an option for our children. That's because people are going back to work. And so what that means is we have students sometimes in unsafe situations, either by themselves or doing things with others that we certainly wouldn't want happening during the day. And that also means as far as following those habits that we know we're going to instill when our students are in class. If you've heard that statistic before, that once you do something 24 times, it becomes a habit. So just think about that. If you're in school all day and you're in one classroom and they're explaining, stay away 6 feet, have your mask on, sanitize. Once that happens 24 times, it becomes a habit. But we're not in school right now. So how are we instilling these habits and making sure that our students are making really great choices? And then, I know we say that probably think this is the primary reason we're here is academic, but as you can see, it's all over the place. We worry not just about the gaps. Heck, who cares if we don't excel on the ACT or something else? That's not what we're really talking about right here. We're talking about long-term gaps that can happen that lead to a long-term impact. You think of the students, let's say, in middle school, who because they're avoiding something academically, end up with severe behavioral issues. So if I'm a student and I'm missing on my first grade reading, and now we've gone almost half a year, and I didn't learn to read, and I got to catch up, and that reading deficit continues and continues. By the time I'm an adolescent, I'm going to act out. So these are the kinds of things that we're talking about that staying out of school will perpetuate. But we cannot say it enough. To be honest, if it was too unsafe to go back, if we did not think we could mitigate risk, if we weren't following every single requirement in the Healthy at Schools document, it really wouldn't matter. But we know we can mitigate risk and make sure that we're working on the whole child. And this is what is so extremely difficult about these jobs, about principals, district administrators, the people who have to make these decisions. There are no easy decisions. Well, yeah, there's an easy decision. I mean, it'll make people mad, but that was just not have school at all and just go straight to NTI for a year. But we know that we have to take into account everyone's viewpoint, every single piece of data and science, keep all the noise out with regards to any kind of partisan kind of things, and some of the stories, and make a decision that is in the best interest of our children. Now, we know making a decision that also is in the best interest of our staff and their safety will make sure that our children are taken care of. But I wish there was a decision that made everybody happy, but that's not going to happen. So we just got to do the absolute best for our kids with all of this information. I can tell you from when we get to the data, I've had 10 stats classes and I have a degree in business informatics, and I've never had to use my stats experience like we've had to here. We don't have great data in Kentucky, so it has caused all of us to fine-tune our statistician parts of our work. So here's what we're recommending, is that we return to in-person instruction on September 17th. And I'm going to go through the timeline of how we even got to this point. But September 17th to return for all schools. Highlands High School, Highlands Middle School, and Moyer have asked that they be able to do a 50% phase-in, because those are our largest schools, on September 17th and 18th. So half on one day, half on the other. They're doing lots of small groups, as you can see, since August 31 up to this point. We're going to be doing small groups. Right now, it's 10 students, but we were told on a commissioner webcast yesterday, it'll go up to the number that daycare has right now, which is 15 students. Also, we can have 20% capacity activities in our larger venues, such as the stadium or in the gym. And so we will continue that so students learn procedures, so that they have social emotional learning connections, so that they have those connections with their teachers. They do some assessment activities, all those kinds of things, so that when we come back September 17th, that we will have full half school to practice transitions for the 3 larger schools. But Johnson and Woodville have not said that they necessarily needed that. There you go. All right. Now, some of the considerations, like why in the world did we get to the September 17th date? Well, first of all, we have said from the beginning, since we'll go through the timeline, that when we had to make the decision because it was perceived as a directive, and then, as you know, that hasn't necessarily played out like that, that we wanted to return to school buildings to in-person instruction as soon as possible if the data support. We did not make the decision to go to NTI based on our data. We did not make it because we thought it was unsafe. We were ready on August 10th to enact our plan and to be in school. However, we had to change course, not of our own, direction. We also wanted to make sure that we started midweek. And that was, our calendar committees have always asked that we do that. That gives you a couple of days for students to try out. I mean, think about this. I get that at NTI, they're up a little earlier. But this would be the first time that students are for 7, 8 hours in one place in 6+ months. And so that takes some endurance. So we didn't want to start on a Monday. And unfortunately, the 28th even was a Monday. We also wanted to give teachers 2 weeks to prepare. That was one of the things that was asked in our reopening task group, and we know that it's very difficult to, if you thought you were doing in-person instruction and then now you did get 2 weeks to kind of plan NTI, and we want to make sure we give enough advance notice for our teachers, and also advance notice for our families. If we have families that need to make arrangements, the other ways, we have a lot of families that now don't have, they're excited because they are not having to have childcare, but there may be others that have specific situations so we want to make sure they had notice. Also, we wanted to have more time for our small groups of students to continue to practice and to learn how to do those transitions. Another consideration is that we are going to have voluntary pop-up site testing prior to September 17th. So Ethos Labs will be in our community at different sites the weekend before the 17th. For any staff, students who want to have free testing will be able to do that. And that'll be something that'll help with peace of mind for people. We'll talk about the 41075 cases right now, but that will be available for people, and we want to encourage people to do that. Also, I just have to say, we have very diverse opinions amongst our staff and our community. One of the things we're working really hard on is diversity, right? Inclusion and excellence, and Bill and Jamie are heading that up, and we have lots of people working on that. And so we know we don't necessarily have diversity and ethnicity and race like we would like to, and we want to continue to work on that. But we certainly have probably the most diverse set of opinions I've seen anywhere, of any community, any staff. And that's a good thing, as long as we all do that in a really positive, productive manner. I will tell you, one of our parents, an elementary parents, suggested that we start a program called a positivity pledge. And that is that our families agree that if there is a conflict or something that is concerning or there's an issue, that they will work through certain channels as opposed to posting things online, on Twitter, on Facebook that sort of demeans people or causes our district to have sort of negative impact. And so we will be doing that soon. She's created a pledge for us, and we'll be working with families soon to ask them to really consider that, to try and go through sort of the channels to answer questions rather than just posting things online that no one can solve. But we know with our staff, and I will tell you that there are those diverse opinions, and our staff as well. So the FTA did a survey, and then we did a survey today based on that to see where our staff and teachers fell with regards to opening on the 17th or opening on the 28th, as they were originally told. And I'm going to tell you, a split down the middle, and could not be farther apart. Some people saying not only the 17th, but can we just come back before that? Like, what about the 14th? And then other people saying, no, the 28th, I can't handle a change. Or that's too much for, I've already planned that time. And it's just very frustrating to have to change dates. And I'm going to say, I agree. I am completely with you. And I wish for every person and every child that we didn't have any of this fluidity. Unfortunately, it's probably going to happen all year. And we're going to talk about this in a little bit, about when we would move to NTI and when we could be, how do we make that decision? Unfortunately, we've not been given like any kind of direct guidance from the state on when would you do that. They have told us, and we have a guidance document called intermittent closures, like you should be prepared for that. But there's no guidance, and so we've been working with all of the Northern Kentucky superintendents and the health department to kind of figure out what that might be. But we understand, and I feel badly for our staff that they were ready to come back, and then in person, and then August 10th, all of a sudden they're told NTI for, it was 6 weeks, basically, that we wouldn't be in school. And then now we're talking about coming back early. But again, when you know better, you do better. So it's really, really difficult for me to say, and you'll see the data, and you'll see the experiences of our schools, and to have schools in our city back in school. But for me to be able to tell a child, for me to be able to tell a family, you can't come back to school because we planned for something else. And so, again, this is why this job is hard. Because it's not about, there's no way to make everyone happy. So we have to look at all the data and look at it in a way that is impartial and make that decision. But I hear our teachers and staff, and I understand that that was a lot of work to plan for NTI. I'm hoping that those will be lessons that we can still use in the classroom or have them available for later. Heck, you could even just continue NTI. I told a teacher today, I mean, if the school wants to just keep that NTI schedule, keep those NTI lessons, but just do it in person, maybe that could happen. But we hate that we have had to do this. I've been trying to let people understand and know things all along the way. It may be that we're also overwhelmed with information, that maybe that was too much. To give information, and maybe we need to be less transparent or have less information. But we want to make sure that everyone understands why these decisions are being made. Okay, so timeline. So I just want to go over the timeline so that everybody remembers kind of why we are to this point, and again, why we are having to make this decision. And let me just point out, too, as well, that when we go to NTI in the future, that will not take a board meeting. Honestly, going from NTI and back is not really a board decision. We thought it's just my decision. We just thought it was extremely important that everyone had input, that we discussed it publicly, because this is a change. But in the future, when we have to go to NTI, that decision is made just like a snow day. That decision is made just like if our attendance is so low, we've never really had to do that, but we'd have to cancel. And so you will not get a meeting. It may be something that we continue to tell everybody, well, the numbers aren't looking good, so we need to be prepared, and then that will happen. So I just wanted to kind of clear that up with the timeline. So first of all, from May, I mean, this has been maybe March and April. The writing was on the wall. We're going to have to change some things. We started a reopening strategic plan. It's a very detailed plan that has 100-some-odd items on there, everything from what do we need to purchase, what staff do we need to have, what guidelines do we need to create? What about staffing? On and on and on. So this strategic plan that we've created, and then we have gone back and made sure we put money, the funding in it. We've also done updates and deliverables. And so we've had that since May up until the point, I mean, we're continuing to do that, but just so you know where we were up to August 10th. We developed our Fort Thomas Independent School Healthy at School document and guidance. Actually, our document and guidance are being used around the state and actually in other states as a model for how can you incorporate all of this. And I will say that is primarily, I shouldn't say primarily. Our district administrators have been phenomenal. And again, working like crazy. Also, our schools. Our principals have been so creative. We, again, are probably only one of the districts that allowed each council in each school to develop their own plan. I don't mean allowed. We said the council needs to approve these. Yes, we have a district plan, but it's vitally important that what is unique to each school is captured and that they approve how to do this. And so every school created and approved their individual plans, tons of work. We have had constant contact with the Kentucky Department of Education, the Department of Public Health, the Northern Kentucky Health Department, all of the labs, St. Elizabeth. I mean, somebody asked, are you all talking to experts? And it was, yeah, Jamie, how many times a day do you talk to the health department? Okay, yeah, every day, she's with the health department. Every Tuesday afternoon for 2.5 to 3 hours. Since March, we have had a commissioner's webcast with questions answered. We are on a first-name basis with Connie, Dr. Connie White, who is the Deputy Commissioner of Public. In fact, we were just at a conference call with her a week ago. St. Elizabeth, we have been talking with them. In fact, I just got, again, from Garen Colvin, CEO, the positivity rate right now for St. E. And also with our different labs. And then schools, our schools have been transformed to follow the guidance and meet the requirements, again, with this idea that the best place for our students is in person with us, if it can be safe. And so, as you know, you would not recognize some of our classrooms, right? Because usually they have lots of furniture, and now it's pretty lean. They are socially distant in our classrooms and spaces, thermal cameras, that can scan the temperatures of 70 people at a time. Massive amounts. We have sanitizer, we have cleaning protocols, we've hired additional staff, we have signage, training, protocols, and our schools have been phenomenal in figuring out how to make this work in a way that is engaging for students, that honors and keeps staff safe, and that included things like creative schedules, cohorts, blended learning. Now, is this what we want to do? Absolutely not. We want school back the way it was. And this daggone virus is not really cooperating. But it's the best, absolute best solution that we can have to meet all of those guidelines and get our kids back. So a little bit more about the timeline. On August 10th at 3 o'clock, Governor Beshear had a conversation call with all of the superintendents on the line and recommended, and I do have that in quotes because we need to explain that schools moved to NTI for 6 weeks until September 28th. Everyone was shocked at that. We thought it was going to be 2 weeks more or maybe Labor Day, but 28th. And the recommendation was based on a statewide positivity rate of over 6%. And you'll see in a little bit, vast differences in positivity rates or incidence rates across the state. We're a 7.5-hour-long wide state. So we can be in Chicago back before we could go across, the state. So wide variety, but there were areas of the state that were of concern. So he recommended this. Now, we were told on many levels, our state association for administrator attorney, our state Department of Education, you guys probably watched some of the events, that this wasn't really a recommendation. And so that's why we always said, if we are told, if we are directed by the governor and the Department of Public Health to close, we will close because we don't have a choice. We've been told over and over, if you don't, all of your liability, your legal insurance goes away. You're basically out there on their own, and we were told that by everyone. But something interesting happened. So on August 10th, the very same day, as you know, and again, wanted to give everybody advance warning, the board already had a meeting, and so we changed the calendar so that our teachers had more time to plan for NTI. We wanted to make sure we took care of that. And so that happened at on August 10th, that evening, it was not based on any concern about health or regional or local positive cases. I mean, the vast majority of school districts were coming back in Northern Kentucky. We had three districts that weren't, but that was because they couldn't follow the guidelines. They either didn't have enough facilities, they didn't have enough staffing, or the funding was an issue. Not because they thought it was unsafe. And so the only reason we went to NTI was because we were told we had to. But something interesting happened that week, as you all probably knew. Not everybody was following that recommendation. Our Catholic schools, we have 40-some in Northern Kentucky, they were coming back, and nothing was happening to them. Then there were all kinds of other districts that said they were coming back, and nothing was happening. And then you probably noticed that the information that was going out was that, well, maybe it's not going to be an executive order. Maybe it's not going to be a mandate. Even our insurance company sent us something and said, well, guess what? We're not going to take your insurance away, which was quite a shock. And as you know, there was also Attorney General's opinions flying around, everything. So the world changed in that week. And so again, when you know better, you do better. So we started to think, okay, we've made this decision, but it was based on faulty information. We know better information now. What can we do? We had gotten an email from the Commissioner of Education that said if any school district thinks they may go back before September 28th, just have a meeting with us so we can kind of talk about it. And so to date, I think there have been 50 districts who've had these meetings, and you probably hear every day more and more going back before the 28th. And so on this call, and that was on August 14th, so that was that same week, we said, well, we are thinking about it, and we've kind of got, a plan for looking at data, and what if this data is good? What if it says we should go back? And so Karen Allen and Ann Meyer were on this meeting, along with our attorney, Mary Ann Stewart, and I, and we met with the Commissioner of Education, the Chair of the State Board of Education, the Deputy Commissioner of Public Health, the attorney for the Kentucky Department of Education, and I think 6 staff members of Kentucky Department of Education. And we described kind of our game plan, which is, here's our Healthy at Schools document, here's our guidance, this is what we're planning, and this is what we'd like to do, regional data, and this is what we'd like to look at. And if our regional data and the experiences of schools in our area and others, provide evidence that we're in a good place, and here's what the evidence would be, what do you think? And they supported us. And Ann and Karen can talk about that. I mean, they said, sure, you can open. That's a great idea. We're not going to stand in your way. And so with that, then we have been, as we've said to everyone, we have been tracking data then for these 3 weeks. So since August 14th, just like we promised, we've been tracking the data, the week of the 17th, the week of the 24th, and the week of the 31st. And so where we are right now with data, so I have to give a little caveat first about why we've had to kind of go out and get data. Some people say, well, why isn't the State Department of Public Health putting this out? Well, that is a really great question. The State Department, the Public Health, if you go on and look at their data, you'll see for the entire state, there'll be numbers of cases. In order to get the state positivity rate, you have to go in, open the PDF for individual days, and take it off of there, which is what we've been doing. Karen Allen's been amazing. She has a background in computer science and math, and so she's helping track this. We have a parent, Emily Morell, who has been tracking the 41075 number every day because you can't get historical information. Heidi Nautner is creating this data dashboard. So we've all been having to go in and every single day track the information. It would be really nice if we didn't have to do that. It would be really nice if these graphs were readily available, but they're not. The other thing is there are no county positivity rates, and let me explain that. When you see in a minute, what does an incidence rate mean? It doesn't mean anything unless you have something to compare it to. Same thing with the positivity rate. We know if we know 4% where the state is right now is good, where are we in Campbell County? Where are we in Jefferson County? we cannot generate county positivity rates, and I'm going to explain why, and you will think I made this up. I'm just going to say it right now, but it is true. We hear about it every Tuesday, and we had a conference call. So number one, the system, the Department of Public Health system is a pretty antiquated system and was a pretty low-staffed system. So their tech program was created in 2004. And the system was not really meant, well, heck, none of us were meant to go through a pandemic, right? But that system was not meant to handle the kinds of data that are needed to be able to generate all of this information every day. And so what's happened is you have a ton of different labs out there. In fact, we just talked to the Northern Kentucky Health Department last week, and in fact, a lot of the labs that are doing Northern Kentucky people are out of state because the doctors are sending the lab work to whoever is the least expensive or who can get them back to them fast. And so it's really, really difficult to keep track of all of the tests. To generate a positivity test rate, you have to have a numerator and a denominator. The numerator is the number of positive cases. The denominator are the number of total tests that were given, including all the negatives. The problem is the regulation that the Department of Health is working under does not require labs to report those. And so they don't report those by county. They don't give that information. And so in the system that the state uses, 2004 system, which is called the KHI technology system, that is what feeds into the national system, which is called NEDS. It's like an automatic. But that KHI system is incomplete because it doesn't include all these negative tests. And so then when the White House report is generated, it's pulled from the NEDS report, and so you can see there's inaccurate data, incomplete data. So anytime you see a county positivity rate, it's false because there is no such thing. And here's how the state is generating their state positivity rate. Every day, again, you're not going to believe this, but it's true. Every day, every lab goes into SurveyMonkey, clicks a link, and adds. These are the number of tests we gave, and it's partly accurate, I guess. You know, the total. It's not by county, but they do the total number of tests and the total number of positives, and that's how we have a state positivity rate. So this is the situation we're in, which means that then we, as a district, and as working with Northern Kentucky, the other districts as well, have to find our own data. We're not making the data up, but we have to go to those sources. And we have to figure out a way to compare it, to see, are we on the decline? How are we doing compared to the rest of the state, and so on. So I know that was enough of a sort of a stats seminar there. Sorry about that. But these are the data we have. So the first of all is the Kentucky positivity rate. And if you can see there where it was pretty high, no wonder Governor Beshear said, hey, we got to do something. Maybe we need to put off school for a little while. Because some parts of our state were in the 100 and 110 cases per 100,000, when we in Campbell were in like maybe the 7. But you can see that positivity rate was over 6%. But look where we are now. We have been steadily declining, and you probably if you watch Governor Beshear's press conferences, or you go in there and you get the daily report, or Fort Thomas Matters will put out the positivity rate, that we have fallen dramatically as a state. So you can see the trend line there. And I'm going to show you on our new data dashboard where you'll be able to see that each day. We have two sources for incidence rates. And this is when we've asked the Department of Public Health, so Dr. Connie White, the Deputy Commissioner, she's the career employee for Department of Health, she's a physician. She said, here's where you can go to get what we would call accurate data, because no such thing as county positivity rates, but if you really want to know what's going on, and that is the Harvard Global Epidemic Site, and also the new Department of Public Health site that they started adding incidences. And so you can see from here, let me tell you what these numbers are, and we've charted these over the last couple weeks as we said we would. The line up there at the top, it's kind of hard to see, that's our districts, our counties, and the state that have the highest numbers. So that gives you some context. That's their number of new cases per 100,000 population with a 7-day rolling average. So we're in the 90s and hundreds in some of these. That purple line, that's the state average. And the reason we want to have the state average there is so you can see where Campbell County is. Campbell County is the gray line under the state average. So some of our highest counties in the state, primarily in West Kentucky and so forth, maybe Jefferson, you know, they might have 60, 70, 80, 100 new cases a day. The state average is around 13 to 15, and we've fluctuated into like 3 to 6, 3 to 5, so we're a third of the state. And I say that because if the positivity rate in the state is 4%, and Campbell County, and Northern Kentucky is kind of all in that same place, Campbell County is a third of the state, that if we could have a positivity rate, it would be lower than 4%. So that's the Harvard one. Here's the state one, which is very similar. It just doesn't have a state average. You can see where Campbell County is compared to our highest areas of the state. Again, we know why Governor Beshear said we got to close schools, because it is a crisis in some areas of our state. We just wanted to advocate for the ability to be able to use our data and what's happening in our region in order to make those important decisions about children. And then also we have the 41075. Okay, so this is exactly in Fort Thomas. If you go to the Northern Kentucky Health Department, you can hover over and you see 41075, and you get some kind of formula that says cumulative cases. So what they've done is they've continued to add numbers of cases since March, but it's per 100,000. So it's a pretty inflated number, a big number, because we have 16,000 people, and so you have to divide it. Or do the ratio so that it's per 16,000. And what's happened is you have no historical data. So again, we are so thankful for Mrs. Morrell, who has been tracking that every day, has it in a spreadsheet, so then she can calculate then what does that mean about new cases. And so these are our new cases. I mean, we never, for a 7-day rolling average, go above a 2.5 per day. I will tell you, we asked the health department, I'm going to try and do this without giving like too much identifying information. Right now, in Fort Thomas, in the 41075, there are 11 active cases. 2 are in, I'm not even going to say what the nursing home is, but it's in a nursing home. 7 are college students away that aren't around, but their data was sent back. And then 2 are middle age but have nothing to do with the school system. They're not households, they're not parents. In fact, one of them might not even actually be living here. So that's what we have straight from the health department as of 4 or 5 o'clock this afternoon. So keeping track of what's going on in Fort Thomas. In addition, here's some additional data. One of the things that we get off that Northern Kentucky Health Department site, and again, thankfully, Emily Morrell is tracking every single day, and that's the active case rate, so that we can see where Northern Kentucky is and where Campbell County is. And we really wanted to see, when these schools opened, was there a jump? And everybody's heard about the Holy Cross one. They had 1 student. Of course, it was the second day of school, so the student did not get it at school, but, they went ahead and closed for a day and cleaned. That's not what we're going to do, because we're going to be cleaning all the time anyway. And when Jamie's here, she can talk to you about, she'll show what we do with exposure. So they went from, on the date that Governor Beshear said we needed to close, 196 active cases, to now we're at 140 cases. That is of today. And that's with 11 parochial schools open in Campbell County, 2 in our city. In Northern Kentucky, as you know, that's 420,000 people. The active case rate dropped from 929 from August 10th to now it's 696, and there are over 40 schools open in Northern Kentucky. We also have a lot of personal connections, gotten like very specific information from Forest Hills, from Williamstown, from the Catholic schools, from Kings. I mean, we have teachers in schools around the region who are parents in Fort Thomas who are providing us with this information daily as well. And all of that is that the procedures are working, the processes are working. Yes, students might be positive coming in, but all the quarantining is working, and so that's kind of where we are. District closure criteria, so I'm almost done here. So that we don't get in this place again where we have to have meetings and surveys, should we open, should we not, we wanted to be very clear about when we would need to go to NTI. And again, I hope we never have to do this, but we may. And so if we have to close the district, we would go to NTI for 14 calendar days. If it's for the over 5% local positivity or the 25 plus cases. Maybe not quarantine, but if we have to because we've got a high level of cases, an outbreak in the community, then working with the health department, 14 calendar days is really what needs to happen. So if we don't have this information yet, the local positivity rate, but we are working on it. I met last week, I sent out a message and people said, why are you working with the chamber? What's that got to do with it? Well, we would like to get all these labs in the region to come together and tell us, one central location, how many positive cases they have and how many negative cases. And they're not gonna do that just for Karen Chesser. But if businesses say it, if all the districts come together, if St. Elizabeth does it, and then Ethos does it, if we can get all that together, we can generate a local positivity rate straight from all our labs. So we're working on that. Or if we have 25 plus cases per 100,000 people countywide. As we've said before, we never have really gone over 7. So if you look at all of the maps, so the Harvard map, the Department of Public Health, that's when you turn to red, when they suggest there be some kind of shutdown. That's at 25 plus cases. We have plenty of counties, and many of them have school going on right now, that are in that red. And then also a review of quarantine data and the impact on schools. So, Jamie's gonna talk to you, and some of you have seen this, about quarantining. We may have quarantining. We expect that that's not gonna come from school exposure, but there may be quarantining from household exposure. And then we could get a directive from the Department of Public Health that says to close. So those are all the reasons we would close. And then the last thing I want to show is this is our dashboard. And again, very much thanks to Heidi Neltner, who learned Google Studio, Data Studio, and will be updating this every day. Also, Karen Allen, who is helping us go get all that historical data from all of the different sources. So one of the things that we will let you know is if we do have staff or students, the number, at schools who are positive and or who are quarantined. We think that's vitally important to let the community know what's going on. And so as we have cases, so far, since students were in athletics and people have come back to school, we've had 1 teacher and 1 student who have been positive. And the whole process worked as far as who needs to be quarantined and that sort of thing. So you'll be able to tell who's quarantining based on a school exposure or not, so you can be aware of that. We will list the number of new cases every day in the 41075. I think we actually were -1 today for 41075 because maybe one was listed twice and they had to go back and do a negative. And then the state positivity rate, we will list that every day. And then from the Department of Public Health, or the Harvard site, the daily new cases per 100K. So you can see where the state is, and then you can see where we are in Campbell County and how different we are from the state. And so that's on the website, and you'll be able to access that. Okay, I know that was a pretty long discussion, but just wanted to make sure that everyone had the facts so that you were aware that this is not taken lightly. This is a very, a decision that definitely impacts our families. It impacts our staff, our teachers, our students, but it's all meant to be for the benefit of our children and our students and doing the right thing. So, Jamie, you want to? Might want to, yeah. Good evening.
Just to clarify, I know that some of our audience members this evening may have already had the experience to view these slides in the presentation, but we find it very much important to review that again so that our Board of Education as well as our public understands the training that we're providing our staff as well as the procedures that we have in place once we do return to school. And so when we consider the beginning works of our reopening, we had much guidance, like Dr. Chesler has shared, with the Kentucky Department of Education. And with that, they provided one essential document that
I got 2 text messages that cannot hear you.
test. Okay, I'll try to use a better teacher voice then to make this work. So originally when we received documentation from KDE, we had a dated guidance of safety expectations that I have shared at previous board meetings.
That's better.
Okay, perfect. I moved it closer as well. And so with that, with all of our work, we started with this document. In this document, it lays out safety expectations as well as best practices that we need to be considering as we return to school. We know with this document that there are modifications. It has been updated a couple of times. And I believe, Bill, on page 6 right there, we can see that most recently this week, 8/31, we have an update. So we, as on a superintendent call, received information and more guidance yesterday on the use of face masks and cloth masks and the expectation of those to be worn continuously throughout the day with the exception of drinking or eating. And so that's been something different that we must consider moving forward. And so as we look at our next phase, we have to receive further guidance from the health department of what this truly looks like. Does this mean that we can have opportunities for our students to have mask-free locations, to take their masks off for a moment to breathe and then return back? Or is it truly that they are masked from the moment they walk into the building until they have a drink or they're eating lunch and then until they leave? So we, fully transparent, need to consider more guidance with this, and we know that we will continue to update our staff with this. As this PowerPoint was presented last week, this is new information for them. So when we look at Healthy at School, we know that there are 5 specific safety expectations. And the first would be that of social distancing. There would be no location within our school building in our classroom instructional areas that has students spaced less than 6 feet. This is very purposeful. With 6 feet, we know that students have the ability to still interact. Now we'll have to consider the masking, but we know that we've reduced class sizes to make that work. We've had an effort with each principal to redesign truly their reopening plans and what that looks like. They are utilizing spaces that may be different than before. Examples could be the gym or cafeterias. In Moyer, we're looking at the bottom level a little bit differently as before, so that we know within the core content areas, we have smaller sizes to accommodate the 6 feet space with desks. We also know that we have staggered our start and stop times in different ways. At the high school, we recognize that 1st and 7th period looks different for many. Historically, we've only had 6 periods. Mr. Pertasso has designed a schedule so that we will allow half the students to come in at 1st period and leave at the end of 6th period. Then we have a second group that will come in start of 2nd and leave end of 7th. So he staggered times. In other areas, in other buildings, they also have, it's just not formalized. They have areas in which they enter and they leave that will be designated for those students that are walking or being dropped off. In addition, we've had to unfortunately cancel our field trips. Recognizing the community spread, we need to control the environments for our students, so we will be looking to make sure that no field trips take place. An exception right now with complete guidance from KHSAA would be that of trips related to athletics. And so we know that there are opportunities for competition, and we are continuing to review that. And with that, that is an exception that does not fall within that bullet of explanation. Then we've also limited our visitors. So unfortunately, no longer for this current school year will we allow a large parent presence. We historically in the past have had parents serve food in all of our lines. In elementaries, they may be coming in for class parties, they may be helping in the classroom. That's not the case this year. so that we look truly at the individuals within our buildings and make sure that they're providing services that are essential for our students. And then Mr. Winkler has developed a plan that's very specific for transportation that does allow for social distancing and masking when needed. We do know that there is very clear guidance, though, for transportation, that students don't have to remain 6 feet while being transported from home to school within that 10 to 15-minute block. Our next would be that of masks, and I know that this is outdated. I purposely kept it the same so that you could see what we shared last week. So we were in a plan where we thought that we were allowed to remove masks at the direction of our teachers, as well as when we ate and when we drank. Now, that's not the case. The big exclamation mark up there tells me we will go back and we will change this. We will also be committed to make sure that our task force, our teachers are all very comfortable with those expectations before our start date. Then, with guidance with what types of masks, that has not changed. So you are allowed to have cloth masks that are 2-ply. You can have surgical masks that are disposable. And then if you have gaiters, there's to be 2-ply as well. If they aren't, they can be folded and serve the same purpose. We did take efforts in July to discuss our code of conduct, and we did add safety provisions for our assistant principals and our principals to consider if our students aren't following our safety expectations. So that has been added, and that does include masking for defiant behavior. And then finally, we know that there's going to be closer contact. We know that there are going to be therapists that are going to be working hand over hand with students. In those particular cases, they will be in full PPE, which means a disposable gown, gloves, mask, and a face shield. Those are all provided by the district so that we can ensure that that is mitigating the risk for those two individuals working together. We also know for speech therapy, we're working on clear masks. We have some prototypes that we're considering so that when we have therapy sessions, we will be able to see the mouth movements of those students. So we're taking particular measures to make sure that we are considering all types of therapy for our students. Then next, the next safety expectation is screening, and this one's important. This is going to cover more so a topic that I'm going to cover later with exclusion criteria of when we do become sick, but it's important to reference here as well. So the third expectation would be that we are screening our students when they come in. This year, we've added information in our update, our online registration update, that parents are given a pledge to make sure that their children are symptom-free before entering the buildings at school. You would look and consider all of the exclusion criteria here. If any of those exist before the beginning of the day, we ask those children to remain home. For those that do enter the building, we will be screening, and Dr. Chesser had mentioned thermal scanners. We have multiple thermal scanners in multiple different buildings. We also have the handheld temperature thermometers that we have had this evening to monitor as we came in. And we'll be utilizing a process so that we will ensure that every student entering the building, as well as employees, are fever-free. And so we've worked with the technology, and that will be installed before our first day. Then for sanitation, this is an additional topic that I will cover in depth in just a moment, but it's important to recognize that we also are going to consider hand hygiene and promote great practices with especially our younger kids as we're working through, but then reminding our middle and our older kids that it's proper to wash our hands multiple times of the day. We will have hand sanitizer located in each classroom, and we have a great supply of that to replenish as the day goes on. We've also looked at our plans and consulted with the health department, and I really should have started the presentation by sharing how much we've appreciated that collaborative effort, because like Dr. Chesser has said, we work directly with them daily. It's not about necessarily the cases that are coming to be. It's about how we can be proactive and prevent cases, or how we're going to be setting up venues, how we're going to be working through specific situations to give us peace to understand that we're following those guidelines, and they're very much willing to work with us at any time without a hesitation. So we appreciate that support. And then as well, we have our posters that we're posting within our buildings that remind us of all of these expectations that I've shared. Living Media has worked with us to create posters that are designated for each different building. They're customized so that it includes the mascots of each of those buildings and reminding our students to wear our masks, social distance, and have proper hand hygiene, as well as our door signs reminding the visitors, if they're just coming into the office, of what they need to do in order to enter. And last but not least would be that of contact tracing, which is extremely important, and it extends our relationship with the health department in a different way. With this, they will be contacting us about positive cases. More than likely, though, we will be aware of a potential positive case before the health department is even contacted, because that student more than likely would not be in school. They will be excluded. And so we will be working to make sure that we follow our flow chart, which you will see in the near moment, so that we will have proper data then to share with our contact tracers. It's our obligation to make sure that we provide seating charts, that we ensure that we can determine who was in within 15 minutes, 6 feet of that individual who would be positive, and working through who we would need to isolate or quarantine based on their decisions of the positive cases. So it's extremely important that we continue that relationship with our health department. And then to collect this information and to make sure that we have a landing page for our public, we have had Heidi Neltner create an additional resource. It is our FTIS Healthy at Home site, or Healthy at School site, not home, that's Healthy at School site. And so with this, we see that it begins with the vision and our guiding principles of why we feel that our 5-day program is so very important and vital for our students to find success. So it lists communication that Dr. Cheshire has shared in the past and reviews why we have made the decisions up to this point with our return to school. It also includes our safety expectations from Jerry, which and our safety expectations that I've shared from our document here. Under learning, it goes over our reopening plans, which is quite interesting. So I know that we've shared that each of our principals and leadership at each of the buildings have designed plans that fit their needs. All of this information is compiled in this location. And so we have our 5 schools listed, as well as remote and our preschool, so that if you're just curious to see how we're servicing our remote learners or our preschool program, you can find different information on this site. And then it leads us to a dashboard that we've just recently viewed from Dr. Chesser, but also health and well-being information. So our dashboard will be located at the top. It will have our exclusion criteria to follow, our flow chart that I'm going to reference in the near future, and then information about contact tracing underneath that. Additional links include technology, which will have information from Jody. Transportation also has Matthew's plans for our bus stops, knowing that we have to remain 6 feet there, how we are screening our students in those environments before they arrive at school. And then the last 2 would be our frequently asked questions, and then our current approach to NTI. So it has all of our information and directs us to our NTI page. This is very important for our parents to recognize that we have that resource on our website. Again, it's on our homepage, and you can see it under our reopening plans. So next, I'll try to go through this briefly, as I know I'm taking a lot of time, but this is extremely important. We recognize that throughout our days, we are going to be faced with decisions based on exclusion criteria or scenarios that occur outside of our buildings, and how do we respond? I can assure you that the health department has reviewed this plan, I want to say weekly, multiple times, and so I can say today this plan is current. I could say that tomorrow we may make a modification based on CDC guidance that may come out or guidance from the Department of Public Health. And so we know this will always be changing, and it's noted at the bottom. This was last updated, I believe 8/20 is what I see, and we will monitor that. Before moving to the columns, I want you to see that there are 5. The most important that I liked to reference with our teachers last week was that the far right, and we'll talk about that one last, as it reviews how then we consider quarantine and isolation and what it looks like for a household that may have one positive case. And then how do you prevent yourself from being a close contact? So we'll end with that. But we'll start on the far left, which would be you have COVID symptoms. So remember that exclusion criteria that we saw on a couple of slides back. You may have a headache. You may be feeling nauseous. And so with that, we are recognizing that you must go home if you feel sick. And so if that's the case, and there would be no diagnosis or reason why you're feeling sick, diagnosed by a physician, then you're going to have to follow what's called non-test-based criteria to return back to school. So if you choose not to go to a physician or get tested COVID, then you're going to have to follow, again, the 3 criteria that's listed. You have to be fever-free for 24 hours. Your symptoms have to be improving, regardless of what they are, and you are going to be out 10 days. So it's going to be advantageous if you have symptoms to either do a telehealth visit or work with your physician with an on-site visit to discuss your symptoms that you're having. Next slide talks about a test that you've received and you know that you're negative for COVID. We also recognize in the description, it says if you receive a definitive alternate diagnosis too. So if you have a fever of 102.3, but you recognize that it's strep, you have a note or a script from a physician that does express that, then if you follow the criteria and you're fever-free for 24 hours, that individual may return to school. Next, this slide and the following discuss COVID-positive cases. The first one would be if you're asymptomatic. Asymptomatics have a different start date for exclusion and isolation, and it's not the same from those that do have symptoms. So if you test positive and you have no symptoms, your clock to start for quarantine would be the date of the test. And with that, if you give us or provide us the documentation that you tested 8/30/20 for positive COVID, you would remain out 10 days from that test date. We also know that date is communicated with the health department, and the health department will discuss that with us. We know the health department releases letters to each COVID positive case, and so that documentation would be something that we would want to consider as well. So the health department will validate any of these cases with us. We work together. So once the 10 days pass, there is no negative test required to return, and that's been something that has changed over time. Many months ago, that was not the case, but now with CDC guidance, 10 days will allow you then to return to school. The next would be those that are positive but have symptoms. It looks very similar to our non-test-based criteria that we described before. It is, but the time starts when your symptoms start. So if you have symptoms one day, you take the test the following day, but don't get the results for 48 hours, 4 days have passed. Those 4 days count in your quarantine out of your 10 days of isolation. And so your physician, your health department will communicate with you on that. And so we would have to know, do you have symptoms or do you not have symptoms in order to make sure that our dates align? Now, the middle, number 2, is very important because this has changed with Healthy at Work guidance. So we recognize that you could have a multitude of symptoms. One may be a cough, and it may be significant over time, and it may take a while for you to improve. It is that you must wear a mask if you return. We know that you've extended your 10 days. You're not with a fever, but you still may have a cough. It's improved. You're going to have to wear the mask after returning for 14 days or until all the symptoms have full recovery with that. So that's something that has changed within the last 2 weeks. And now we're getting to our last column. Our last column would be that of contact of a positive case. And so we know that we may have families within our community that have a positive case. With that case, that individual that has a positive, that individual is going to follow 10 days from the criteria that I shared earlier. So 10 days from the test date or 10 days from the onset of the symptoms. After that individual has recovered, the household then starts their 14 days of isolation. They've isolated the 10 days as well, but they have to isolate 14 additional days after that case has recovered, which would mean that everyone in the household would quarantine, besides the initial case, 24 days. And so we recognize that that would be impacting our teachers, our staff, our students, and the households. And so we will be working with each case specifically and make sure that we have proper date arrangements on their return. And that would be in consultation with our health department. And then finally, when we're thinking about close contact, this is crucial for us to understand as a district. If you are within 6 feet for 15 minutes or longer, you will be forced into a quarantine for 14 days if an individual was in that circle with you during that amount of time. So again, if we maintain 6 feet or further, and we watch our time to consider that if we have to move closer for a small amount of time, then those individuals are not going to be considered close contacts. And so we are hopeful with the consultation with the health department that no one would have to quarantine for 14 days and that we would be keeping our students and our staff safe with the limitations that we have in place with furniture arrangements and instructional environments. So finally, I do want to cover our cleaning protocol on behalf of Jerry, who I believe is here in the corner. So this, over the past couple of weeks, he's shared this with our teachers and our staff members. I feel it's also important for our public and our board to hear that we have taken extensive opportunities to look at the ingredients of all of our cleaning products, and we can ensure all of our stakeholders that those ingredients and the products are safe. There are vendors that have provided statements as well as those products being on an EPA-approved list. And so it could range from our wipes that we're using to sanitize to the solution that we're spraying on the desks, various other products. We know that we feel safe about the use of those throughout the day by both teachers and by students. We felt it necessary to make sure that our teachers had specific criteria. So we were very clear with 10 steps of expectations of a transition. And we are providing this to teachers. This is actually going to be posted in their classrooms as a reminder so that after we consider instruction, before we leave the room as students, we will be taking specific steps to make sure that that space is clean and sanitized before the next individual takes ownership of that space. And so we're going to be using masks while this takes place. Students and staff members will mask. The teachers will be spraying the cleaner. Then the teachers will be providing paper towels. The students will be wiping enough to spread the solution, but not drying it, so that it will allow 60 seconds of contact to kill any virus that would exist on the desktops. The teachers are going to be utilizing that opportunity to clean common surfaces. The teacher's going to walk back around, grab a garbage can, collect the paper towels. They're going to use hand sanitizer. We're going to exit the room still masked, and then we're going to wait until we have the next class coming in. Now, thinking about frequency, at the elementary, it's not going to be every 50 minutes or 60 minutes like the middle or the high school, but it will be multiple times during the day when the teachers see fit for that to occur. So that concludes the safety protocol and the COVID flow chart. I don't know if there are any questions, but I'd be happy to ask any at a later time if they do come up.
I just think we want to repeat that all of these measures, while we are the vast majority of who's in our school are students, 3,200 students, they are really meant to make sure that our teachers are safe, our staff are safe, and that we limit any type of exposure that would come from school. So, also the cleaning, we didn't talk about it, but we have electrostatic sprayers that are spraying at night, right, Jerry? And there's all protocols for all of this, constant cleaning in the hallways, and so it's an ongoing process.
Okay. Thank you, Karen and Jamie. I know that that was a long time, but I think everybody in this room needed to hear it. I think the people watching on YouTube needed to hear it as well, to stress how important this is to us and how seriously we do take it. So at this time, I'm actually going to wait till Mr. Beach comes back in, and we'll start. The order will be Dawn Hills, and then Amy Schaefer, and then Carol Dixon, and then I believe it's Chris Talent, is that correct? Talent? Okay. And then Clem Fennell. So that will be the order. Oh, did Clem leave? Oh, he did. Okay. What? Oh. Yeah, so we'll just wait a second. I don't want to start public comment without one of us here. We didn't want to start without you, so sorry. Okay, Dawn, yes. And so you can take your mask off at the microphone. We ask that you please wipe it down when you're done, and then put your mask back on, then wipe it down when you're done. And Peggy will start the clock when you're ready to go. And we're gonna take notes. It's not gonna be a question and answer kind of thing. So we'll take notes while you're talking.
All righty. So the best laid plans of mice and men, right? A month ago, we had what seemed to be the best plan, but not enough control of the virus, at least on the state level, as evidenced by Dr. Chesser's slides tonight. We have learned a lot in the last month, and we are very grateful for that time. Our understanding is that the importance of masks has obviously really evolved. And we are learning that these masks are going to be a real game changer. And for that, I'm hopeful that we will have a confidence boost and a morale boost among our faculty and staff. But please know that teachers are torn. They are truly torn. Some are eager, some are terrified. Most are at least uncertain. Everybody has different views, and those views are very valid. So I'm not here tonight to say, please do one thing or another. I'm just here to validate the different feelings of all of our faculty and staff members. We are all trying our best, the board, the teachers and staff, the community. The important thing to remember is that we need to be frustrated with the virus, not with the people. Right? As you know, we have teachers and staff who have many chronic conditions. They're taking care of elderly parents. Their children might have conditions that are concerning. The uncertainty is very real. But the important thing to remember is that while our survey results are split, we truly appreciate and want to express that appreciation tonight for the ability to share our feelings. And so thank you for that. And most importantly, let's just keep reminding ourselves that we are all on the same team, right? So thank you.
Thank you, Dawn. So if you'll put your mask on and then wipe down, I'll try to remind everybody, and then Amy, you will be up next.
Good deal.
Thanks, Dawn.
And it's safe to wipe that microphone, right?
Yes.
Technology. All righty, thank you very much.
Thank you, Dawn.
Good evening, everyone.
Make sure you're talking close.
First, I'd like to thank everybody, especially Karen and the leadership, the Board of Education, all of the teachers and administrators. Y'all absolutely have been doing yeoman's work. My name is Amy Schaefer. I'm a 1991 graduate of Highlands High School and a mother of 3 students in the district. I am a former educator and the current director of the foundation. I spent 3 years on the Johnson Site-Based Council, retiring in June, and currently sit on the Middle School Site-Based Council. In addition, I am a member of the Reentry Task Force for the district. I am also immunocompromised. I take the COVID threat very seriously, but I also realize that we have to learn to live in a COVID world. I also take seriously our responsibility to make balanced, data-driven decisions, and commend you all for doing just that. Based on all of the data and information you all have gathered about COVID and our district's response, I want to publicly share my full support for our schools returning to in-person learning. It has been 173 days since our students have been in a school building. 173 days since our valued and professional teachers have provided in-person instruction to our students. 173 days with no social and emotional support from our district's professionals. Our schools have a legacy of success with a laundry list of accolades to support it. I humbly and emphatically support your decision to open our schools for in-person learning. Let our students and staff once again show Kentucky and the country how to succeed. Give them the chance to learn safely and productively in a COVID world. Thank you.
Thanks, Amy. If you would wipe down the surface and the microphone. Thank you. And then next up is Carol Dixon. I think that was, oh.
Hi, my name is Carol Dixon, and I come to you today as an immunocompromised person who is married to an immunocompromised vulnerable person and also has daughters with asthma. So I come to you in that regard, but also knowing that our children are the most important and the best way they learn is in person. So I just want to let you know that my concern is that this goalpost always moves. It's abundantly clear that there are people in power positions that do not, and this is not you guys, but they do not want us back in-person school or playing sports, no matter what the cost. These people have acted as bullies. Do this or else. The problem is every time we concede on one item, there are more requirements added. At what point is the cure worse than the disease? I think that time is now. I've seen our schools transformed, cleared out, sanitized. I've worked with our students who come in and comply with those rules. I've helped my own kids buy supplies, prepare for in-person, then NTI. We've comforted our kids in their moments of frustration, and I've talked through very anxious moments with my kids and students for months. Big, anxious moments for months. Today I say enough, no more. 15 days to slow the spread, quarantine, sanitize, don't touch, masks if you're sick, if you're not 6 feet apart, waivers, no assemblies or field trips, masks inside always, isolation, voluntary testing, mandatory testing for sports, participants. I am a biological foster adoptive mom of 4, ranging from high academically to low, outgoing to introverted, sensory seeking, ADHD, and recovering from severe trauma and neglect. And I would like to leave you with the things my own kids have said. Mom, can I still hug you because we're family? They said we should stay 6 feet apart. I didn't get my hug. Sorry. It's my first hug from that child until I had him for 6 years. Another child said, Mom, does my mask make it easier for someone to steal me because they don't know who I am? Mom, I need to go back to school. I also like to breathe. Which one is more important? I want to help students learn and meet them where they are, but learning when not face-to-face just isn't the same. I don't feel like we'll be as well prepared as I would have been, that from my college daughter, who, in spite of everything, wants to be an educator. So I just implore you, please, please urge the higher powers that be to stop the nonsense.
Thank you. If you could put your mask on and then wipe down, I'd appreciate it. Okay. Next up is Chris Talent. Are you passing? Okay. And then Clem is not here, correct? Okay, that concludes our public comment section. Thank you, everybody who came and spoke. We appreciate that. What we're going to move on to now is our action item, which is a return to in-person instruction. And that's going to be our chance as the school board to address any of the folks that spoke tonight, address any of the emails that we've received, our own personal comments. And something that I just want to stress is the five of us work really well together. We always have. We don't do this because of politics. We don't do this with politics in mind. We do this with our kids and our staff in mind. And for 16 years that I've been on the board, and I know these folks have been here as long, if not longer, they have done the same. And so our decisions are about kids and education, and it doesn't involve politics. Unfortunately, that's part of our world right now, but it's not part of this decision. So I'm going to open it up to my fellow board members for their comments, their concerns. We'll discuss what this is about. If you have questions for any of our folks that are here, let's go ahead and have those conversations. So who wants to go first? Speak, somebody. Make sure your mics are on and close. Well, we'll let somebody go. Somebody else. Go ahead, Brad.
Well, I really don't have a whole lot to say. I mean, there was plenty said here tonight, and we are unbelievably well prepared. Let me first say that thank you so much to Dr. Chesser and to Bill and Jamie and Karen and everyone who's spent countless hours, and I can't even imagine. And it's just going to continue, too, because I look at all of that stuff that's necessary as far as the contact tracing and everything, and it's going to be a really, really hard job. And, this thing is scary. I'm scared. I'm immunocompromised, a word I just unfortunately had to learn over the last 6 months. But, this is a moving football, and we've got to get back to some sense of normalcy here. In my world, in my opinion, we don't know what this thing's going to do. I mean, September 28th is just another day, in my opinion. The science, everybody says follow the science. Well, the science is all over the place. And, science in this case is research and analysis of historical data, and there isn't any. So in my world, I support the decision, and I appreciate the efforts.
Okay. Anybody else want to chime in? Lisa, you have your mic now.
There we go.
Just speak close.
Okay. I just want to say thanks to everyone who has worked tirelessly. I know everybody says that, but it's true. I've seen everybody from our staff and other board members, the task force. It's just amazing. Well, no, it's not amazing because I'm not surprised at all with everybody who is here and working in our district. And it was a lot of information to take in, but I am very confident that we are up to this task across the board, and I'm very comfortable with my decisions. So,
You want to go?
Yep, thank you. So, thanks, Dr. Chesser. That was a great presentation. I know a lot of folks have asked of what we've been doing, and that certainly was a great summary. I wanted to start because I wanted to, during my last board meeting, I mentioned KEA in a discussion about the date changing, and I wanted to apologize to our teachers for doing that. So I brought it up last minute, and it certainly, I didn't want it to reflect on our teachers that have been very supportive and involved in our putting this, what you saw together tonight. I directly talked to our FTEA leadership this week and apologized to them. I didn't get a chance to talk to all of our teachers, but I'm available to talk if you'd like to. But I didn't want it to reflect on them. And I wanted to mention it tonight because I wanted to make sure that folks in the community didn't think that I was pointing that finger. So I was sorry I did that. So I wanted to mention it tonight. But following up on the discussion about on reopening, I am in favor of doing so. I have mentioned that in the past, but I want to make sure it's done safely. And a colleague had mentioned that in our last discussion around the calendar, we didn't talk about really the safety stuff that we saw tonight during that meeting. Now, I think a lot of us in this room have seen that all summer, and so it's really ingrained in the head, but we didn't talk about it. And I don't know that that was the right way to do it, because I think people are really looking to say, hey, are we doing this right? I think we are. I think looking at the data the way we are doing so is the right way to do it. But again, it changes, all the time. We've learned a lot just in the last 3 months, and I think we'll continue to do so. I did want to address a couple things from questions that I got from folks around the timing. There's people that want to go back tomorrow. And it's a great question. I think, Dr. Chester, you addressed this. Teachers have put a lot of time in to their NTI work, and I've seen it. My kids are getting worked over, so it's good. But they're not robots. They just can't flip in the switch, and they could if we ask them to, but it's not fair. They need some time, and we should give them time to prepare. And I think 2 weeks is reasonable. On the flip side of that, there are folks that have asked, why don't we just wait? Because we talked about the 28th at the last meeting. Again, I think it's reasonable for a couple weeks. Is it the right decision? I hope so. It seems like the right decision. But I don't take it lightly. I'm not just picking a time, and this is a decision that I knew we'd have to make all summer, ever since we closed in the spring. And it is. I've never made a decision like this in all the years I've been on the board. So I'm worried about it. I'm worried about going back. I think we can contain, if somebody goes inside our school and tests positive, I think we can contain it. I hope we can contain it. We have the right procedures in place, but I'm worried about it. Our teachers and our students, of potentially assisting in the spread by being open. So it is a concern. So I don't take it lightly, but I do support going back. I pray that we'll do it right and that things will go well and our students will succeed, and we won't have to go to NTI during the school year.
Ann?
I too support it. Talking about time, I want to go back as fast as, someone said, why don't we wait till the 28th? It's only 7 more days. Well, that's 7 more days that a non-reader isn't learning to read. That's 7 more days that kids aren't learning math like they can in the building. And, we as teachers worry about the summer slide. We're at summer slide ×2 right now. And I know that they've been doing assessments, and it'll be interesting to see what they have found. But, Dr. Richardson and I had a long conversation because his son is an engineer. And they learn a lot of math in 12 years to get to be engineers. And we have stopped, not totally, but we've slowed down that process for those kids last year since March. And so I worry about that too, the sophomores that aren't going to know, just the basics that the kids have to have. I also know that I think every teacher is like this, but since I know all these people, if you tell our teachers we're going to NTI, they're going to be the best NTI teachers in the world. And then you tell them, okay, now in 2 weeks we're going back, okay, now I got to be the best classroom teacher in the world. And there's some stress with that. And so I want us to be aware of that and to feed into that and talk to the teachers, because they are stressed, because they want to do the best for kids. So, and I applaud them, and I really appreciate all the teachers as well.
And I love what Dawn said, because I keep saying this to people as well. We're on the same team, you know? It's the virus that we don't like, not each other. And this has been a charged discussion. And I really come from a true place in my heart that we have the best teachers. Teachers need to be in front of children. They just need to be in front of our kids as fast as possible, so.
That leaves me, and I also support this decision. As I began, as Karen has mentioned tonight, as I began to look at the data as we started pulling this, knowing that we had to do this on our own because there's nobody giving us those kind of metrics, it really made me feel better. I'm a very, as Karen said, I'm a computer science math major, so I'm a very data-based decision maker. Although a lot of people say I'm emotional, but I make decisions based on data. And once I started pouring into the data really said to me that we're in a good place in this area, and I know based on all of the conversations we've had since March that we've put the right procedures in place to keep not only our students safe, but our staff safe as well. And I was gonna quote Dawn too, because I really like what you said, Dawn. It's the virus that we need to be angry with. It's not people, it's the virus. And so let's not take our anger out on a situation that hurts kids or hurts our staff. And so I'm very supportive of this. I think it's important. We, as Karen said in some of our conversations with parents, we have got stories of kids that are having problems. We can't fool ourselves in this community to think that we have mom and dad who get flexible work schedules, who get to work at home, or dad goes to work and mom stays home and helps the kids with NTI. That's not the majority of our community anymore. It's not the way it works. And so we have kids that are in situations that need help. And they need help to be in front of buildings. And to Ann's point, we're summer slide times 2. It'll almost be 6 months to the day when we left buildings on March the 13th to when we returned to buildings on September 17th. And I think about it, and we can't go back to March 13th. We can't go back, as much as we all want to in all aspects of our lives, we can't go back to what was normal on March 13th. But we can provide some kind of normalcy back for our kids, and I think it's really important. And I'm very convinced that we will continue to make data-based decisions. So Karen's laid it out, and we have the best staff in the world, and I know that they care about the kids as much as anybody. And they want not only those kids to be safe, but they want those kids to flourish. And I think that that's what can be done here. And so we will continue to work with the staff, we will continue to work with the health department and make those decisions that need to be made. And so I do support this as well. I do want to acknowledge that there is stress, there's fear, we've all experienced it, we've all had anxiety, we've all felt the isolation. And so think about that and put yourselves in the situation of a 7-year-old and how they feel. It worries me a little bit that for some of our kids, they're going back into buildings for the first time in 6 months and they're gonna have masks on. And I worry for some of our little kids as to how they're gonna do. But I know that our teachers will be there and our principals will be there, especially with our little ones. Our counselors will be there. I see Whitney in the audience tonight. I know that they'll be there for those kids because I do worry. They've been at home with mom and dad or brothers and sisters, and they're gonna go back into the building and they're gonna have masks on, which they've never done in a building before. And so it will be different. But we'll make it the best that we can do for our kids. And so I agree as well. Does anybody else have anything, any of the other board members you want to add to anything? If not, I mean, to Karen's point, this really wasn't a school board decision. So we didn't have to get together and have this meeting. We didn't have to allow public comment. It really would have fallen on Karen's shoulders, which I think she's already had enough this summer on her shoulders. I wouldn't have asked her to take this on. But moving forward, it will be like a snow day, and some of it may be directed by the health department. So we all, as the board, thought that it was very important that we have a vote tonight to support going back to in-person instruction on September the 17th. So with that, if there's no further comment, I need a motion and a second to return to in-person instruction beginning September the 17th, 2020.
So move. Second.
All those in favor, please say aye. Aye. Opposed? Okay. And with that, our meeting is adjourned. Thank you, everybody. Please remember to put your masks on when you leave. If you want to take a wipe and wipe down your areas, that would be most helpful, although we will probably clean as well. Thank you.